My name is Jeffrey Wisinski. I work in the Family Medicine Department and serve as the Assistant Program Director for the Primary Care Sports Medicine Fellowship at Prisma Health. I am from Erie, Pennsylvania. My educational background is being an osteopathic physician. I went to Penn State University for my undergraduate education and then went to Lake Erie College of Osteopathic Medicine, or LECOM, for my medical school training. I then went on to do my residency training at Allegheny Health Network in Pittsburgh and back to Penn State for my primary care sports medicine fellowship training. My goal is to serve as a family medicine and sports medicine physician while also teaching fellows, family medicine residents, medical students, athletic training students, nursing students, any healthcare professional for that matter, and also serving as an advocate for my patients. I strive on a daily basis when I see my patients to listen, understand my patients, understand everything about their background, get to know them as a person, get to know them so deeply that I can be able to understand and realize everything about their past medical history. And when the time comes for me to provide appropriate education, treatment recommendations, whatever the case may be to help them, I strive to use the training that I've gone through to adequately provide that. I have significant curiosity in the human body. I love getting to know people. I also love movement. As a former student athlete and as a former athlete, I strive to always utilize the phrase that exercise is medicine. I'm a firm believer in that. So with every patient as clinically appropriate, I try and incorporate that when it is possible, especially when it can enhance a patient's quality of life. To educate and inspire health in my patients, number one, I start with listening. I try to understand where patients are at. Some patients can come in with a variety of background and understanding of their health conditions. They may already even have a good idea about what can work for them. Other patients, you might have to provide a little bit more guidance, so that's completely fine. I try to meet patients where they're at, provide them with appropriate advice. I use a variety of tools to help with patient education, whether it be handouts, in-person examples of how to do certain things or how to perform certain things. If a patient has to have their blood sugar checked, I try to make sure that we even go over a video to make sure they understand how to do that. If I prescribe home exercises to help with a musculoskeletal condition, I try to actually show them right in front of them how to do that. As an osteopathic physician, I practice holistic medicine, meaning I just try to understand the patient completely. And through my getting to know them, I think I can provide and understand the best communication skill to communicate with them and ensure that they understand where I'm coming from. My interests outside of medicine are spending time with my family. God has blessed me with a beautiful wife and 3 beautiful children, as well as 2 amazing dogs. So family time, quality time is my number one hobby. I also enjoy serving our local church as well and getting to know people through our local church. Being active with my children is something I just strive to do every day. I do, again, believe exercise is medicine, so I obviously want our children and my wife to be as healthy as possible. So we try to incorporate movement and getting outside, doing things like riding bikes, playing in a playground. Now being in South Carolina, maybe even doing some water-based activities as well. And outside of family time, I do enjoy exercising as a runner, playing pickup basketball, slowly getting to understand golf. I think that'll be a lifelong pursuit and definitely a work in progress, but all those are my interests outside of medicine. To make an appointment with me, please call the number on the page.